Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Welcome, you're Mr. Jefferson, correct?
Yes, that's correct. You can call me Tom.
Great, Tom. Your primary care doctor referred you to me because you're having issues with tendinitis, I believe.
Yes, that's correct. I've had problems with it on and off over the past year or so.
All right, I've got some notes from your doctor, but why don't you give me your perspective? When did your tendinitis first appear? What treatment have you had? What worked for you? Anything you can recall?
Sure. It started when I had a mishap at the gym, probably around 2 years ago. I was doing some heavy lifting and felt a sharp pain. That slowly improved, but the tendinitis popped up about a year ago. It took a good 3 months for it to really get better. Now it's back and has been troubling me for the past 2 weeks.
And your doctor confirmed it was tendinitis?
Yeah, I was having this pain in my elbow, and she said it was due to overuse and inflammation of the tendon. The pain was sharp, and it would worsen when I tried to lift something, or even just when I moved my arm. The worst part was that I couldn't even hold a cup of coffee without feeling pain. At times, my entire arm felt numb. It was pretty strange. Due to all of this, I was unable to continue my job as a warehouse worker properly.
How did your doctor manage this condition?
Initially, she gave me NSAIDs for the pain. I was also told to apply ice packs. That did provide some relief, but I was still unable to use my arm freely.
Okay.
Later, she referred me to a physiotherapist, and I received some therapy sessions, but the improvement was minimal. Then I was referred to an orthopedic surgeon who advised a few exercises and massages to do at home.
Did you receive any other kind of treatment?
Yeah, I was given a corticosteroid injection for the inflammation and also tried therapies like ultrasound and electrical stimulation therapy. I even thought about trying acupuncture, but by then my symptoms were starting to lessen, so I decided against it.
Which treatment would you say was most effective? What made the significant improvement?
Honestly, I can't pinpoint a specific treatment because it took almost 2 months without any significant improvements. But then in the 3rd month, I noticed a drastic change. I believe it was more of a cumulative effect of the treatments rather than one single treatment.
Did anyone discuss with you what might be causing your tendinitis?
Most people guessed it was due to my heavy lifting at work, but no one really confirmed it. I know there's this condition called golfer's elbow, which causes pain on the inside of the elbow, but that wasn't exactly what I had.
Did anyone ever talk about how your lifestyle might be contributing to your problem?
Well, I remember.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Peter Mitchell, please come in. Have a seat.
Thank you.
So, your GP referred you to me due to a concern about your foot, correct?
Yes, I saw him about a month ago because of this rash on my right foot. It's been coming and going for a while now. See, it's here, on the top of my foot. It has faded a bit now, but my GP couldn't identify it, so he recommended I visit a dermatologist. He sent some pictures. Did you get them?
I did receive them, yes. Could you describe the condition to me a bit more? The feelings, symptoms, and...
It starts with a burning sensation. I get this tingling and the urge to itch at night. After a day or two, I notice small red bumps. They merge into a big patch over time. The whole area feels hot, and the skin around it gets swollen. My GP called it unpredictable. It eventually calms down, and a scaly patch forms. After about 3 weeks, it heals, leaving a discolored patch like you can see now.
I see.
This first happened to me when I was working in Africa in the early 2000s. I had a project there for a year or so. The first time, I also had a similar rash on my arm, but that never returned. This one on my foot, however, comes back, say, every 2 years, never at the exact same spot. I thought it was something to do with the environment, but then it returned even after I moved back. It doesn't seem related to my lifestyle or diet or stress levels. My GP thought it would be best if you took a look, also because I had a basal cell carcinoma on my neck removed back in 2010. It was detected quite early and was superficial.
That's good to hear. Let me just take a look at your neck. Was it here?
Yes, that's the spot.
Okay, well, everything seems fine here. I don't think this foot condition is anything severe. Have you ever had issues with athlete's foot?
No, not that I recall. But I did think this could be some kind of fungal infection. Isn't there an antifungal cream I could use to prevent it from appearing?
There are antifungal creams, but they work best when there's an ongoing infection. It might not be as effective in preventing the onset of your condition, given the thick skin on your foot.
I see. Is there a risk of the area getting infected? Should I keep it covered?
No need for that unless the skin breaks open. It should be fine otherwise.
That's a relief. The condition hasn't really affected my daily life significantly. I just thought it was high time to get a professional opinion.
Okay, so you primarily wanted to know if there's a way to prevent the rash from reappearing. The best course of action now would be to schedule a skin biopsy. It may be slightly uncomfortable, but it will help us eliminate certain possibilities.
All right, sounds good.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Mr. Johnson was brought in this morning for post-operative rehabilitation. He had a hip replacement surgery a week ago due to severe osteoarthritis. He's an active 70-year-old with a history of hypertension controlled with medication. His diet is well-balanced and has no known food allergies. He needs assistance while walking due to the recent surgery. We've started him on light exercises, which he's performing quite well. His progress is in line with expectations, except for some mild pain and discomfort. His vitals are stable, blood pressure is well managed, and he's been in good spirits throughout my shift. Around 10:30, I gave him a hot pack treatment for minor pain, which helped him feel better. He has a routine appointment later today for wound care. He's on a low-dose aspirin to prevent blood clots.
Now look at question 26.
I'd like to discuss our protocol for communicating with patients and their families. It's commendable how well everyone has adapted to the new system, and as a result, we've seen a decrease in miscommunications by 30%. Our data analysis has brought up a curious trend. Misunderstandings seem to be more frequent during shift changes. We're not exactly sure why, but it's an observable pattern. Also, it's evident that interruptions during patient handover can lead to critical information being missed. So please ensure a quiet, focused environment while carrying out handovers. Lastly, we need to be especially sensitive when explaining medical terms, diagnosis, and treatment plans. Our patients are young, and their families are often anxious. We have been successful in this regard, but given the challenging conditions our patients are facing, we need to continuously work on our communication skills.
Now look at question 27.
Let's discuss our new patients from the evening. Mark, could you start us off?
Of course. We have Robert Hughes in room 7. He's a 65-year-old male who was referred to us for suspected lung cancer. He has a history of smoking and chronic obstructive pulmonary disease. He presents with persistent cough, unexplained weight loss, and shortness of breath. He will remain under close observation until we complete all necessary diagnostic tests and determine a treatment plan. We'll be monitoring his respiratory status, comfort level, and any side effects from diagnostic procedures.
Got it. I'll examine him and review the imaging reports this afternoon. What about his discharge plan?
We need a social worker to discuss post-treatment care, home modifications if needed, and potential support groups. That's scheduled for the day after tomorrow. We also may need to involve a legal advisor for any medical power of attorney decisions.
Perfect. We'll discuss this in our team meeting tomorrow.
Now look at question 28.
Mrs. Robinson, what brings you in today?
I wanted to discuss my son's vaccination schedule.
All right. So he's due for his 12-month immunizations?
Yes, that's right. I have been reading a lot about vaccines, and I am a bit concerned. I have heard about the option to spread out the vaccines. What do you think about that?
While some parents prefer to spread out vaccines, the recommended schedule is designed to protect children as early as possible from serious diseases. Delaying vaccines can leave your child vulnerable, but we can discuss any specific concerns you have about individual vaccines.
All right, I understand. Also, he had a bit of a fever after his last vaccination.
It's common for babies to have mild side effects like a fever after vaccination. However, it's a good sign that the vaccine is working. If he seems unusually fussy or the fever lasts longer than 48 hours, please call us.
Now look at question 29.
How did your day go, Emily?
Well, I had some trouble administering insulin to Mr. Thompson. I've done this procedure multiple times before, so I wasn't overly anxious, but I didn't expect his fear of needles to be so intense. Given his diabetes, I assume he's had to deal with a lot of injections, but he seemed really scared today.
Well, that can happen with patients who have a long-term fear of needles. It can make it harder for them if the procedure isn't handled with care.
He was very patient, didn't complain at all. I would have been far less calm in his shoes.
Well, next time, let's try using some distraction techniques or numbing cream to make it easier for him.
Now look at question 30.
All right. So I understand you've been feeling tired and sluggish for a few weeks now. Is that correct?
Yeah, I just can't seem to shake off the tiredness. I just thought it's because of the schoolwork.
You definitely seem pale and your energy seems low, but I don't think it's just school-related stress. Does your heart race when you climb the stairs?
It does, and I feel out of breath, even with minimal activity.
Well, I suspect you might be dealing with iron deficiency anemia. It's common in adolescents, especially girls. I can't confirm without a blood test, though. If it's anemia, we will need to address your diet and possibly start you on iron supplements. But let's get those tests done first.
Oh, I see. Okay.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today we're speaking with Dr. Lisa Baker, an endocrinologist and diabetes specialist in the UK. Dr. Baker, could you tell us about diabetes and why it is often termed as a lifestyle disease?
Sure. Diabetes is a chronic disease that affects the way the body regulates glucose, or sugar, in the blood. Type 1 diabetes is an autoimmune condition wherein the body doesn't produce insulin at all. Type 2 diabetes, which is more common, is where the body doesn't respond to insulin as it should, and in later stages may not make enough insulin. It's called a lifestyle disease because it's often associated with obesity, physical inactivity, unhealthy diet, and overall poor lifestyle choices. However, genetic factors can also play a significant role.
I see. What concerns do we have about diabetes in the UK?
Yes, the concerns are significant. Diabetes is one of the leading causes of preventable sight loss in the UK and a major contributor to kidney failure, heart attack, and stroke. According to Diabetes UK, as of 2021, there were over 4 million people living with diabetes, and this number is projected to rise. It's a serious public health issue that requires concerted efforts to tackle.
Could you please describe a typical patient scenario?
A patient, let's call him John, came to see me because he was experiencing frequent urination and extreme thirst. These are common symptoms of diabetes. He was also overweight and led a sedentary lifestyle. He had not been to a doctor in several years and was quite scared. After running some tests, we discovered that John had type 2 diabetes. He was shocked and initially felt helpless, but we assured him that with lifestyle changes and medication, he could manage the disease effectively.
What challenges do you face in treating patients with diabetes?
Treatment challenges can be quite varied. Take, for example, a patient of mine named Sarah, who was diagnosed with type 1 diabetes. She requires insulin injections multiple times a day and has to monitor her blood sugar levels regularly. This can be distressing and can impact a patient's quality of life. Sarah also had to drastically alter her diet and exercise habits. Despite these changes, managing her blood sugar levels can still be challenging due to factors like stress, illness, or even hormonal changes.
And do you deal with patients in later stages of the illness?
Yes, indeed. One of my patients, let's call him David, has been living with type 2 diabetes for over 20 years. Unfortunately, he did not manage his diabetes well in the early stages and is now suffering from complications like diabetic retinopathy, which has affected his vision. He also has neuropathy, resulting in numbness in his feet. His case emphasizes the importance of early intervention and regular monitoring in managing diabetes.
So, what can be done to fight diabetes more effectively?
Research into new treatment methods, including the development of more sophisticated insulin delivery methods, is ongoing. Education about diabetes is crucial, particularly in relation to diet and exercise. Also, screenings should be more commonplace so we can catch the disease in the early stages. Lastly, healthcare providers and policymakers need to work together to develop strategies for preventing diabetes, especially in high-risk populations.
Dr. Lisa Baker, thank you so much for joining us today.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hi, everyone. My name's Lucy Rogers. I'm a speech-language pathologist working at a leading neurology center. Today, I'm going to present a case study to illustrate the kind of work I do. But before we dive into that, let's consider what we understand by speech-language pathology and the role it plays in patients' recovery. In simple terms, clinicians like me help patients across all age groups to improve their communication and swallowing skills, employing a variety of proven techniques. For instance, this might be aiding stroke victims regain speech and language abilities, or assisting children with developmental disorders, such as autism, to communicate more effectively. But what's crucial to remember is what the individual hopes to achieve. Like an occupational therapist's first question is, what matters to you? My first question is, how do you want to communicate? Now, let's talk about my case study. The patient is a woman named Jane, a 55-year-old professional singer who suffered a stroke that left her with aphasia and dysphagia, impairments in her ability to speak and swallow. When I first met Jane, she was deeply distraught. Her livelihood, her passion for singing, and even her ability to enjoy a meal, all were in jeopardy. Jane was initially resistant to therapy. Some team members at the center thought that if she refused to participate, there was little we could do. However, I viewed things differently. Since Jane couldn't articulate words or swallow properly, we started working on nonverbal communication techniques. We employed assistive devices that she could use to express herself and even to sing. Meanwhile, we also worked on a variety of swallowing techniques, including exercises and positional strategies. And how did my therapy assist Jane? We started with simple sound exercises, which Jane initially found extremely challenging. But gradually, she began to discover ways to produce sounds using other methods. For instance, she learned to hum tunes which she couldn't sing outright. While this process was often frustrating for Jane, she began to understand that unless she engaged in therapy, she might never regain her ability to communicate or swallow. Jane was in therapy for about a year, and there were highs and lows. Like when she had her first recital after her stroke. She thought it would be a triumphant return, but was disheartened by her performance. Despite preparing her for this reality, the experience was still a setback. Yet, as with many patients, it also marked a turning point in her recovery. Jane grew even more resolute in her efforts to regain her speech and swallowing ability. I am thrilled to tell you that Jane's story has a positive ending. She's back to singing, albeit in a different way, and she's learned new ways to swallow safely. Relearning these skills took all of her strength and courage, but patients like Jane, who harbor a strong will, make significant strides after discharge. They continue to improve, seeking speech therapy, practicing exercises, exploring new communication methods. Observing this progression instills a deep sense of pride in the work I do and the meaningful impact it has on people's lives.